Hello everyone. Here we'll try to understand what is abnormal breathing like Chyne stroke breathing and Biot's breathing. Chyne strokes breathing, when respiration shows alternate waxing and waning of tidal volume, is called Chyne stroke breathing. Physiological causes are voluntary hyperventilation, high altitude, during sleep in some individuals, especially in infants. Some of the pathological causes include chronic heart failure, brain damage, uremia, and poisoning by narcotics. So, this is the respiratory pattern that we see in Chyne stroke breathing. So, there will be waxing and waning of the depth of the breathing, so which is called as Chyne stroke breathing. Explanation for voluntary hyperventilation. Voluntary hyperventilation for 2 minutes produces apnea followed by respiration. This cycle keeps on repeating, but with with a decreasing duration of apnea until the respiration uh, comes to normal. Mechanism is hyperventilation causes increased alveolar PO2 or decreased PCO2, and decreased alveolar PCO2 cause apnea and PO2, and apnea results in carbon dioxide accumulation in the body with the gradual increase in the alveolar PCO2. As long as increase in the alveolar PCO2 remains below 40 mmHg, that is the threshold level, apneic spells will be there. Fall in the alveolar PO2 less than 60 mmHg, that is hypoxia, via peripheral chemoreceptors, they stimulate respiratory center producing hyperventilation. In heart failure, it occurs mainly in the left ventricular failure and is associated with pulmonary congestion, producing hypoxia leading to stimulation of respiratory center, and thus ventilation increases. In heart failure, the circulation is slowed down from the lungs to brain. Therefore, when such individuals hyperventilate, it takes longer than normal time for the blood to reach to the brain. When this blood reaches the brain, the low PCO2 inhibits the respiratory center, producing apnea. It can occur in brain damage if there is a brain damage of supramedullary inhibitory pathway. The medullary chemoreceptors become more sensitive to the action of carbon dioxide. Thus, pulmonary ventilation increases, so carbon dioxide is washed out and alveolar PCO2 falls, producing apnea. As a result, carbon dioxide accumulates, alveolar PCO2 rises, and the respiration gets stimulated. Effects of uh, periodic breathing will be there will be fall in the arterial PCO2, which causes severe vasoconstriction of the cerebral vessels. As a result, cerebral blood flow decreases, producing dizziness, and hyperventilation sometimes lead to respiratory alkalosis. Biots breathing. This is a type of periodic breathing in which there are 3 to 4 cycles of normal respiration followed by abrupt onset of apnea and again abrupt onset of normal respiration. It is seen in case of meningitis, severe brain damage. Kussmaul's breathing is known as acidotic breathing or air hunger. It occurs in a case of metabolic acidosis, as in diabetic ketoacidosis and in renal failure. The respiration is characterized by rapid and deep breathing, which occurs due to the stimulation of respiratory centers by increased H plus ions. The main action of H plus ions in the blood is via peripheral chemoreceptors. But H plus ions can slowly cross the blood-brain barrier when the concentration is high and persistent. In that case, the central chemoreceptors are also stimulated. Its, uh, its aim is to wash out carbon dioxide and thereby to correct the acidosis. Here, the blood PCO2 level are low. So here, this is the pattern, which is a respiratory pattern, which is seen in birds breathing. There will be a phase of apnea, then which is followed by the normal regular breathing. Again, it will be followed by apnea, again the normal breathing. This is in brief about abnormal breathing. Thank you.